how much should be the vitamin D level? So, mean to say, so what should be the normal range of vitamin D in our blood? And see if vitamin D level is low, if it is too low, then what are the health issues, what are the problems that are going to arise? Earlier, so this vitamin D testing was generally not being advised. So, but nowadays, so whatever the complaints you have, so any along with any blood investigation, so this vitamin D as well as the vitamin B12 is being generally being advised. So and in this blood testing, so more than 50% of the patients are showing some less vitamin D levels. So what is the normal range of vitamin D? Generally, it is said that it should be around 50 nanogram per ml. That is plus or minus certain. So it should be the range should be between 40 and 60 nanogram per ml. If it is less than 40, they consider it as a low, and if it is more than 60, they call it as a high vitamin D level. So, but actually, patients will develop the vitamin D deficiency symptoms when it goes less than 20 nanogram per ml. Because when it is 5 or 10 nanogram per ml, generally the patients will develop the symptoms of vitamin D deficiency. Where do we get this vitamin D? So vitamin D is produced within our body. It is not through any food. It gets produced within our body. So whatever the food we consume, that will be having certain amount of fat. There is fat in the sense it will be cholesterol. So the fat, the amount of fat which gets absorbed into the circulation, the amount of fat which our body needs gets absorbed into our circulation. The cholesterol which is circulating in the blood, some amount gets stored in the skin. Every cell of our body needs this cholesterol. So a certain amount of cholesterol will be stored in the skin in certain form. And when we get exposed to the sunlight, the ultraviolet light in the sun converts this stored cholesterol in the skin into vitamin D. That means to say, the vitamin D is being produced within our body from the cholesterol which is there in the skin using the sunlight. That is the ultraviolet radiations of the sunlight. So what for we need this vitamin D? So vitamin D is necessary for our bone. So if bone need to be stronger, then we need this vitamin. Immune cells also need this vitamin D. So for immunity, for our good immunity, we need this vitamin D. Heart cells, that is myocardial cells, also need this vitamin D. For normal functioning of the heart, we need this vitamin D. And this vitamin D also prevents the cancer. See, cancer anywhere in the body. If the vitamin D level is normal, it helps to prevent the cancer. And for the brain also, we need this vitamin D. So when it is normal, it prevents depression. And also for insulin sensitivity, the vitamin D improves the insulin sensitivity. So insulin is necessary for the glucose to be utilized by the cells. So normal range of vitamin D helps to prevent this type 2 diabetes. So when we call it as a deficiency, when it is less than 20 nanogram per ml. When it is 5 or 10 or 15 nanogram per ml, we call it as a severe deficiency. In such case, only the patients will develop certain symptoms of vitamin D deficiency. Like there will be fatigue, excessive tiredness will be there will be fatigue, mood changes will be there. Suddenly, patient gets the anxiety, gets the depression, gets the anger. So mood changes will be there. Then pain, in the pain, again, muscular pain is more common. That too, cramps, muscle cramps, especially calf muscle cramps will be so more common. So along with that, the pain we also experience in the bone. So bone pain, muscle pain as well as the bone pain will be there. And this vitamin D helps to improve the immunity. When there is a deficiency, when there is a lack of vitamin D in our blood, in such case it results in infections, repeated infections. Once in 15 days or 20 days, we start getting this infection. Could be respiratory infections like cold, cough or fever, or even the boils. Frequent boils are also seen in case of vitamin D deficiency. And in the skin, especially the acne is more common among the vitamin D deficiency. And also the skin allergic condition called as eczema is also common when there is a severe deficiency of vitamin D. Vitamin D is also necessary for the cells of hair root. So when there is a severe deficiency, it can also result in hair fall, there is hair loss. So blood pressure also well maintained when our vitamin D level is normal. And when there is a severe deficiency, it can contribute to high blood pressure. And the endothelial cells of our vessels, blood vessels, also need this vitamin D. And deficiency of this vitamin D into these cells can result in rupture of the vessels, smaller vessels, and it can result in the stroke. Then again, the heart muscle, they need this vitamin D. So when there is a severe deficiency of vitamin D, it can result in certain heart diseases. It may result in certain heart diseases. And this vitamin D is mainly necessary for the metabolism. Every cell of our body needs this vitamin D. So the metabolism also require the presence of this vitamin D. So when this vitamin D is severely deficient, in such case, the metabolism will be delayed, the metabolism will be slow. So whatever the food we eat gets accumulated in the body, gets stored in the body, resulting in a weight gain. Excessive fat will be there. So when there is a severe deficiency of vitamin D. So all these things can happen when the vitamin D is too low. That means when it is less than 20 nanogram per ml. And again, even if it is a deficient between 20 and 40, don't go for any medications. Even severe deficiency also, you can avoid medications. You can naturally improve your vitamin D level because this is being naturally produced within our body. We don't need this vitamin D from outside. So avoid medication. If you need a precise and scientific information about health, then only you subscribe to our channel. Namaste.